They call it the silent illness. That's the adults, but it's affecting our children too.
I've felt like sick and dizzy and really shaky and worn out.
To look at Finley, you might think he's an ordinary 10-year-old boy, and of course he is. But he also has recurring COVID symptoms, which are so bad he hasn't been able to go to school. Beth, his mother, knows he has long COVID and just wants some help to get him better.
Blood test results keep coming back as being clear and okay. All the scans he has are okay, but he still remains with a lot of these long COVID symptoms, sort of headache, fatigue. You can hear he's belching quite a lot, and it's all, he's had a lot of vomiting and nausea. I've had some of the consultants suggest it's long COVID, and then others completely dismiss that, but without any other answers.
Recent data suggests up to 8% of children who've had the virus suffer long-term effects. So widespread, the NHS is opening 15 new paediatric clinics in England to help treat young patients. They're being modelled on a pilot already running in London.
What we know about chronic fatigue, which is a similar but different post-viral syndrome that children have, is that they have better outcomes and they recover. They're more likely to recover than adults. And we are optimistic that that will be the case for our cohort. Of the young people that we've been seeing in London, they are all recovering.
Adult long COVID clinics like this one have been up and running for almost a year now, but they're already overstretched and are desperate for more resources. With more and more patients needing hubs like this, the extra investment is absolutely critical.
Cannot complete, please don't worry.
Susan is one of thousands benefiting from long COVID clinics, but consultants here admit we're only just starting to understand how big a problem the disease could be.
We started receiving around 5 referrals a week in January, February. As of the last 2 weeks, we're receiving up to 50 referrals a week at the moment. I think we need to be prepared for ongoing support, at least for the next few years, to be able to provide support to these patients. Beyond that, I think we're still having to learn and see what the evidence tells us.
Ooh, try that way.
COVID has left a long shadow over Finley and his family. As health officials decide whether children should be vaccinated, they just want everyone to see the effects the virus can really have. Emily Morgan, News at 10.